dear Lord, show me right from wrong. Give me light, make me strong. I know the road is long, make me strong.
Ladies and gentlemen, good evening and welcome to the #1 show that provides you with the news and views of all things medical. Doctor in the House is back on board, and as usual, our theme is healthy lifestyles. Thank you to our cherished and much loved viewers and callers, and also thank you for all of your letters and emails and calls. I know that you will enjoy the fantastic program that we have in store for you. As usual, it's the open forum. We are live on a Monday night with a rerun on Saturday afternoons at 1 p.m. on IBN. We are also streaming, so as I always say, you don't have to pay exorbitant cable rates because it's free streaming online on the IBN website. We're also streaming live on YouTube. The IBN Master is what you search for on YouTube, and you would be able to hear all of your Doctor in the House programs. So as usual, let's start with a bit of the medical news over the last week. Well, some general news. Congratulations to Sanjali Maharaj of St. Augustine Girls High School and Vishala Goon of Lakshmi Girls Hindu College, who both won the President's Medal and topped the CAPE examinations this year. This is a hat trick of wins in terms of the President's Medal for Lakshmi Girls. So it's the third consecutive student receiving the President's Medal. And out of 382 scholarships awarded this year, we certainly wish to congratulate all of the students and indeed their parents and teachers. God's blessings as well to some of the other winners, Joshua Manik-chan from Freeport, Matthias Rambali, both of them from my alma mater, presentation in Shogunas, and they did exceptionally well. Caitlin Lachu Rampasad and Savita Pari, and indeed their families, once more reflection of the faith and the discipline required to succeed. The Doctor in the House team would want to wish God's blessings in your future endeavors. Now, you would look at the scholarship list, and indeed at all levels of academia, and would have noticed over the past few years that girls have continued to outshine boys. And I thought that it was appropriate that the theme for International Men's Day, which has been held on November 19th since 1999, is Celebrate Men and Boys. Now, it was started by my older brother, who is a lecturer in history at the University of the West Indies, Jerome, to celebrate our father's birthday on November the 19th. So happy birthday to Dad, Reverend Daniel Teelucksingh. The objectives of International Men's Day include a focus on men's and boys' health, because another thing which is seen is that the life expectancy for men tends to be shorter than that of women, improving gender relations, promoting gender equality, and highlighting positive male role models, which of course some may say is a reason why we've seen such a problem with the crime rate, the scourge of crime. So it's an occasion in Men's Day, so on November the 19th, it's an occasion for men to celebrate their achievements and contributions, especially to that of the family. So November 19th started in Trinidad and celebrated in more than 60 countries worldwide on November the 19th. As I mentioned, the scourge of crime, unfortunately, continues unchecked locally with more than 400 murders so far for the year. And there was a reminder from my good friend as well, the secretary of this Psychiatrists Association by Dr. Varma Teelucksingh to remember that mental health issues are also affecting victims of crime. And perhaps we don't often bring that into the front burner when we speak about crime, but mental health issues like anxiety or depression can often, or post-traumatic stress, can often be seen in victims of crime. The whole idea of mental health was also brought out after the tragic suicide of a young university graduate from Princestown. And certainly our thoughts and prayers are with the family members, and may she rest in peace. Just a reminder that if you think that you may have issues with your mood, or you may be grappling with that black dog of your depression, some of the symptoms may include a lack of sleep, problems with appetite, a loss of interest or zeal in things that used to have pleasure before, low self-esteem, loss of memory or concentration, suicidal thoughts, feelings of hopelessness, helplessness, and worthlessness. That remains one of the illnesses, unfortunately, that we still have a social stigma attached to it, the whole idea of your depression. And seek help, seek help. Call Lifeline. There's a 24-hour toll-free hotline which is available for you or a family member at 231-2824 or 220-3636 or 800-5588. Lifeline 231-2824, 220-3636 or 800-5588. Lifeline, it's free, it's readily available 24/7. They have been fielding more than 4,000 calls per year from volunteers, and certainly we wish to congratulate them for the yeoman service that they continue to provide in the country. And of course, we're talking about crime and trouble in the schools too. On our last program, I always mention it on Doctor in the House, that the idea of bullying was also brought to the forefront in the last few weeks. And I know the Minister of Education was wondering if whether banning camera phones would be a solution to some of the problems plaguing our schools. Now, admittedly, the use of the camera phones, they can be a distraction, especially if you're in class. Obviously, you don't want to be sending a WhatsApp message while your teacher is in front of the whiteboard. But at the same time, too, that may represent rather simplistic approach, I would think, and whether or not banning the camera phones is going to make a difference, because certainly it's highlighting problems within the school system that need to be addressed. And unfortunately, many of the school children seem to be emulating some of the politicians, as we often find ourselves taking ringside seats in the mass media to the usual political shenanigans. And I know that the opposition will be locked soon in an internal election battle in the month of November, and lots of the toing and froing and threats of imprisonment. And let's hear what happens in terms of the politics. We're thinking about the Christmas season too, as we move in the constant feasting here. We moved from the holy time of your Diwali and food associated with that into Christmas. And many of the advertisements, unfortunately, have been taking the Christ out of Christmas. I'm already seeing ads with liquor-shaped bottles, so bottles of alcohol shaped like a Christmas tree, unfortunately. It was interesting to see when we're wondering about hard times and austerity measures and a need to tighten your belts, as we've been told, and yet our import bill for alcohol is $669 million for the year. That's phenomenal, just for alcohol. And we know that that remains one of the causes for many socioeconomic and psychological and physical issues plaguing the nation. Speaking about some of the holidays and some of the times that we'll be having over the next few weeks, V.S. Naipaul, the Nobel Prize laureate from Central Trinidad, who now lives in England, once wrote of the mimic men, and we still continue to be mimicking, as we're seeing so many of the ads are bombarding us for Oktoberfest, which is a German drinking holiday as well, another time when you might be overindulging and imbibing, and Halloween, so that Samhain time Not saying, so apart from the fact that it was a pagan holiday, Halloween and Oktoberfest so very much westernized things, as if we didn't have enough issues with childhood obesity, alcoholism, and rotting teeth to grapple with. So over the last week, we were struggling with widespread flooding. There was widespread flooding nationwide. And I think that the media was quick to highlight, especially the social media, was quick to highlight the poor response by the authorities. In fact, we were even told that it was no big thing, but we saw those zones, those terrible zones of flooding, and I want to congratulate the superb relief efforts from this blessed national community. I mean, they were true heroes, and these are the heroes who should be getting national awards, like the men who braved the ravaging waters in Kaparu to rescue a pregnant woman. From a health aspect, from a health standpoint, a nation which is reeling from the effects of flooding must also bear in mind that there may be public health challenges, including sewage, chemicals, and waterborne germs that may be mixed there. There are also troubling reports about infected wounds. So I know that there was at least one drowning of a mentally handicapped man. We have to be vigilant about affairs of electrocution and some of the animals in water, mold and mental health issues that may be as a result of the flooding problem. A reminder that should we have any more of that, no diving or swimming in the flood waters. So it was advised by an engineer in the media to underwash and degrease all of the vehicles, especially if you drove through flood. And I wish to congratulate the members of the IBN team as they came fresh on the heels of a positive relief effort in the islands of Antigua and Dominica after the hurricanes. I wish to congratulate them for their local relief efforts, and indeed our good friends too. I know I know the leader of the pack there would be Inshan, but Dr. Amina Khan, I spoke to her about the medical clinic, which was held on Sunday. That was Sunday, October the 29th, and that was a very successful one at the Baraka grounds in Shogunas. I wish to congratulate all involved in not just the relief efforts subsequent to the flooding, but also the hurricane efforts in the rest of the West Indies. And I think it's a good time to acknowledge the brilliant work as well too from Mr. Akalu, or Mr. Sheikh Lisha, who is also one of our firm fans and viewers on Doctor in the House. World Food Day was held on October the 16th, and we had a reminder too that farmers were urged not to sell flood-soaked produce at markets. Perhaps it's time too that we compensate the farmers adequately, especially in areas such as central, south, and eastern Trinidad that were ravaged by flood waters. There have been numerous cases of leptospirosis. So this may be a rat or dog-borne infection. So it's a germ that is spread, and especially if you may have cuts or wounds that comes in contact with contaminated water. So if you drink water or you eat food that may have been contaminated, you may get leptospirosis that can be marked by kidney and liver failure. And in Puerto Rico, after Hurricane Maria, the death toll so far has been at 51, and there have been numerous cases of leptospirosis. So remember, that's something that we are seeing here too, and we usually see a surge in the incidence after the rainy season, and I expect so following the flooding. So be very vigilant about that, leptospirosis. Of course, around this time of the year too, a reminder about the flu season, which tends to start in the latter part of October in North America and Europe. Get a flu shot, especially if you're at risk. In fact, it's been thought that you'd want to vaccinate everybody over the age of 2, particularly those at risk with chronic medical illnesses, such as diabetes, cancer, or kidney failure. So if you're pregnant, persons at extremes of age as well, to it weakened immunities, and healthcare workers. So get your flu shot in time. And of course, basic hygiene to prevent the spread of these respiratory tract infections that tend to be spread by droplets in the air. A 31-year-old man in Houston died of a flesh-eating bacterium and that medical term is called necrotizing fasciitis that can rapidly become fatal after he assisted in cleanup efforts in Texas following Hurricane Harvey. So that's something to also bear in mind, that infected wounds should be treated promptly and by a respected healthcare professional. It's been thought to with climate change that we'll also be seeing a lot more of these changes like flooding and hurricanes in the coming years. And it's been said in New York City that some of the flooding over the next 5 years would be expected. Maybe every 5 years that you'd be seeing severe flooding in New York. The Trinidad and Tobago Heart Foundation has been a supporter, if we just change the pace a little bit, has been a supporter of Go Red for Women, which is a social initiative designed to empower women to take charge of their heart's health. And I know that there was a fundraiser from the Heart Foundation last weekend. Just a reminder for women to look after their heart health. We know the month of October is sometimes referred to as Pinktober because of the plethora of pink ribbons that might be around as they seek to raise awareness about breast cancer. But it's also important to know about the #1 cause of death in the world: heart attacks and stroke, cardiovascular disease. And knowing your risk factors is the first step towards battling this hidden epidemic, or this epidemic of cardiovascular disease. And some of these risks include diabetes, high blood pressure, high cholesterol, a family history of heart disease, smoking, sedentary lifestyle, and obesity. Some medications and some medical illnesses may all increase the chance for inflammation to the lining of the arteries and subsequently cardiovascular problems. So knowing risk factors, just a reminder, especially on this healthy lifestyles theme. And I'm sure we'll be discussing this in time to come. As we go across to the sister isle, and I would also like to welcome our viewers in Tobago, so the sister isle. So I know that we have some firm fans, and now that we're also streaming live, many of those individuals are also interested on the show. The regional health authority there had to compensate a mother of a teenage stabbing victim. So a victim from an incident in 2010. Apparently the hospital in Scarborough discharged him despite the fact that he had a CT scan. So he's a victim of stabbing. He had a CT scan, and when he went home, he died a few days later. The post-mortem showed that there was trauma to his lungs, liver, and kidneys. So the judge there has ruled that his mother would be compensated following his death. Regionally, congratulations to a Guyana-born black businesswoman who has been named the most influential black person in the United Kingdom over the last week. And she has been very instrumental in launching the Brexit legal challenge. So that's the big thing where they voted to see if the United Kingdom would be leaving the European Union. We always like to talk a little bit about diabetes. And we know that we've spoken about type 1 and type 2 diabetes. There was a reminder in the last week by some British researchers about type 3C diabetes, which occurs after trauma to the pancreas, such as a pancreatitis. And just a reminder that many of those persons with this so-called type 3C diabetes may require a stronger medical intervention than type 2. So you've had a lesion, you've had an inflammation of the pancreas, a pancreatitis, and you become a diabetic. But frequently, those individuals are told that they may have type 2 diabetes. But persons with type 3C diabetes, so trauma or some sort of damage to the pancreas, or lesion on the pancreas, were twice as likely to have poor blood sugar control than those with type 2 diabetes, and indeed were 5 to 10 times more likely to need insulin, depending on the type of the disease affecting the pancreas. So, but just a reminder, it would be something to talk about with your doctor, especially if you think that your diabetes is not just due to things like obesity, a family history, but polycystic ovaries and so forth, that it may be due to a lesion, trauma, or damage to the pancreas. Type 3C. Speaking about diabetes, there was an interesting study looking at type 1 diabetics. So those are usually younger, lean persons who have some of the antibodies attacking the pancreas. So those cells that would normally produce insulin are depleted. And the type 1 diabetics, well, they need insulin from the outset. And many of the persons, especially if they're diabetic when they're younger, find that when they reach the teenage years, it's part of the teenage angst, that they find that they want to skip insulin. They may be depressed as well too, very frequently, but depression and diabetes tend to coexist. We spoke about that as well. And that can snowball into a slew of complications, including issues with the eyes, the kidneys, the nerve endings, and of course, heart attacks and strokes. Researchers looked at two groups of teenagers with type 1 diabetes. So one group, they gave them a financial incentive, $60 per month. So that's US, so that's in America, 60 US per month to manage their diabetes well. So make sure that they're monitoring their sugars, make sure they're taking insulin, that they're doing blood tests and follow up with their doctors. And the other didn't get that cash incentive. And what they found is that the group with that cash at stake, 60 US per month, was nearly 3 times more likely to hit their daily goals for blood sugar levels. So that's interesting. Financial incentives, small, but for teenagers with type 1 diabetes, that group was 3 times more likely to meet targets. So that's interesting. And whether or not it will be applicable on a larger scale is yet to be seen. Similarly, a small American study showed that the older persons with poorly controlled type 2 diabetes or found that they were struggling with their weight, they were obese, and we know that the whole idea of type 2 diabetes and obesity is that they are twins, they are twin epidemics, and in fact, diabesity is often a word that is coined to describe persons with both issues. And they had a reduced level of sugar at the brain, and that can lead to adverse problems in the brain, like memory issues. High intensity training. So if you're exercising, you're running, so you're trying to get in your cardiovascular fitness in, high intensity training for 12 weeks was found to increase the levels of sugar in the brain. And of course, that's a good thing because the brain requires glucose as a source of fuel. So if you're obese and you're type 2 diabetic, you have reduced levels of sugar in the brain, but that can be increased. So you can actually make your brain sweeter, if you wish, in inverted commas, by increasing the amount of aerobic exercise, running, jogging, biking, swimming, trying to increase that physical activity and dancing away from the sedentary lifestyle that will increase your chance for heart attacks and strokes. Going further to Canada now, a small study there as well showed that food products that claim to have reduced sugar or no sugar would be added, although they can be healthier and lower in calories, they can still have a certain amount of sugar, and some of it can actually be higher than the recommended levels from the World Health Organization. So although you're reading your labels, you're reading your packages, they're saying that there is no sugar that's added or there's lower amounts of sugar, remember that they still have certain amounts that can impact on your glucose control and be contributing to obesity. So it's recommended as well to, in that small study in Canada, to continue having a diet rich in whole foods. Having more meals at home might also be useful too, instead of having meals at a restaurant. Fruits, vegetables, peas and beans, nuts, low fat and low salt, and of course, a supply of fish if you so desire. Staying in the theme of healthy living, persons with prediabetes and obesity in a study called the SCALE study showed 3-year improvements in weight loss and had an improved quality of life with a once-per-day injection. So it's not available here. This injection is called liraglutide and once per day. So it's a drug which has been approved for weight loss in the United States. And they looked at persons who had that injection versus those who didn't. Persons who were obese and they were pre-diabetic. So they were not full-fledged diabetics yet, but they were on the threshold of becoming so. And they found that once per day, that injection was able to help them lose weight and was also improving quality of life. There was a meeting of bariatric surgeons recently that showed as well that perhaps the structure of hearts may be healthier amongst 51 patients who lost weight after gastric bypass and other forms of bariatric surgery. So we know that that is increasingly becoming a tool in the armamentarium to fight this obesity epidemic and to also deal with diabetes. So over the last week, there were some studies showing that there was an increased risk of early menopause among underweight women. So we want you to think about an ideal target weight. It's something to chat with your doctor about as well, that women who are underweight had an earlier menopause, and there was a lower risk for that in persons who were actually obese or overweight versus normal weight women. So up to 10% of women who experience an earlier age of menopause. So in Trinidad, that age may vary from, let's say, 45 to 55 years. And an earlier age of menopause, if you're underweight, may increase your chance for heart attacks and strokes. And it may also affect your memory, it may thin your bones, and perhaps may put you at an increased risk for premature death. So that's why that is important too. Premature menopause comes with subsequent medical problems. Cholesterol levels have started to fall over the last few years in the United States, but the British Medical Journal this week, so that's one of the top journals in the United Kingdom, following up 3,200 patients, showing that long-term statin use, so I know that lots of the callers and viewers are always interested about statins and the management of high blood cholesterol, but long-term statin use seems to be associated with an increased risk for type 2 diabetes in approximately 30% of persons at high risk. Now, this is not a call for you to stop your statin, because of course the benefits of these drugs, and there are billions of patients worldwide who have been involved in studies and trials since statins have appeared on the medical market, and the benefits of the use of statins far outweigh risks, especially if you've had a heart attack or stroke, if you've had blockages in your arteries, if you're a diabetic, perhaps aged 40 to 75 years, if you are at an increased risk for having a cardiovascular problem, or if you have that bad type of the cholesterol, a low-density lipoprotein, which exceeds more than 190, that is a reminder that you may be one of the candidates to start a statin. So, but it's something to bear in mind that in persons who are taking especially higher doses of statins, that there's been definitely a link towards an increased trend for type 2 diabetes. So I'd like to say as well to a special good evening to my friend, Dr. Omardeen, Feroz Omardeen, one of the co-hosts on The Doctor in the House. He sent me an interesting message as well too this morning about healthy lifestyles and how some of the advice that we often preach and we often talk to patients about, we haven't been seeing it borne out in studies. In fact, a lot of the evidence seems to always be changing. A lot of the recommendations seem to always be changing. And we have seen that over the last few months, especially when it comes to advice about diet and healthy eating. And now we're seeing some of the recommendations. One must be vigilant about the use of certain medications. Cataract surgery now, so we move into the eyes now. That is the commonest operation done, I think, locally and perhaps worldwide. And one of the associations in the United Kingdom that normally would make recommendations for doctors and the public published guidelines about cataract surgery in the last week. An interesting observations in the United States, though, is that older women who had cataract surgery may actually be at a lower risk of death. Now, which was just an interesting observation, but whether or not it was due to the cataract surgery, maybe perhaps that if you have your surgery, you're less likely to fall. It might be a simple association like that. But they found that those women, especially as they were growing older, were at a lower chance for death. So in the United Kingdom, it has been estimated that perhaps more than 400,000 cataract operations per year are performed. And it was a reminder too that don't wait until patients are blind. So it's almost like a lottery where patients are often sent out letters and they are called in for their surgery. So I know, unfortunately, I'll have a lot of viewers saying that they're waiting for operations in the public sector for years while they're slowly going blind. But one of the recommendations is that don't wait until that happens and the quality of life of the patient is affected. Cataracts, but just a reminder too that that's where the lens in the eye, so the eye is like a camera, and there is a lens there, and that lens in the eye becomes cloudy.